When Catherine was born to James and Eleanor Macaulay in 1778, little did they know the precious baby they held in their hands would grow up to be a formidable woman. Unfortunately, they would not get to marvel at the path she would choose. At 20, Catherine had lost both her parents. By then, she had already established herself in the Catholic faith when she was taken in by her relatives. Catherine became their house manager and caregiver. When one childless couple she was looking after passed away, they left her quite a hefty inheritance. Instead of creating a lucrative and prosperous journey for herself, she chose the road less traveled, the path of mercy.
Catherine Macaulay had a real heart for people, and she learnt that from her father. And it was in Ireland in the time of great famine that she saw the way her father actually cared for people. And that spirit really grew in her of really being aware and attentive to what was around her. So she had a great spirit of generosity, a great spirit of care. And for me, I've come to understand generosity as not giving what is over from what I have, but giving of what I have.
Through the compassion they showed to the less fortunate and especially girls, the numbers in the congregation began to grow.
So generosity, hospitality. Catherine Macaulay was an incredible woman for being inclusive of everybody. She used her inheritance to build a great house in Baggot Street, Dublin. And it was the most fashionable part of Ireland that you could find, because for her it was about showing the rich the need that they have to be aware of the poor. And Catherine was a shrewd woman. She knew how to bring the rich and the poor together.
What started as one house of mercy in Dublin in Ireland soon became a global movement, and Sisters of Mercy began to spread out. Kenya much later became part of that outreach.
Well, I came to Kenya in 1973. At that stage, we were from time to time we would be asked to volunteer, maybe for America or for Red Houses in America or for Kenya. And I kind of felt that I'd like to, I think I had that in my head for a long time, that I would like to come to Africa, I suppose we called it, at that stage. So I came.
I am Sister Louise Roach from Ireland, from Cork, St Mary's of the Isle, and I'm here for 21 years in Kenya. I'm very happy with my decision to come to Kenya, and it was very fulfilling, I must say, and still is.
In 1955, Archbishop J.J. McCarthy wanted a Catholic hospital in Nairobi, and for this he turned to the Sisters of Mercy. Not knowing what challenges lay ahead, the Dublin Sisters of Mercy did not cower. Instead, they forged on. Sisters Dolorosa Waldron, Gerard Stark, Therese Noel Gallagher, and Consolata O'Keefe, the pioneer sisters to Kenya, arrived on the coastal beach of Mombasa on 1st April 1956. They were somewhat unprepared for the challenges that lay ahead, starting with the weather. Then there were the mosquitoes, but this would soon be the least of their worries.
When they arrived in 1956, it was a very difficult moment because it was just before the state of emergency was declared. Arriving through Mombasa, they had one mission: to come and respond to the calls of the time.
The sisters did not stay in Mombasa for long, as they had a mission in Nairobi, and so they soon embarked to the capital city, not knowing what lay ahead. The times were difficult. Kenya was still very much a colony, and any person with white skin was treated with suspicion by locals. Winning the hearts and minds of the indigenous Kenyans would prove difficult but not impossible. Instead of just empty rhetoric, the sisters let their compassion and mercy be seen through the work of their hands. They started a healthcare in Makadara to care for the underprivileged in the surrounding areas.
And it was started from the Mercy Sisters Convent. It was the first convent in East Africa. Then later they built the dispensary, which was opened in 19th March 1988 by Cardinal Maurice Otunga. This dispensary benefits the community which is around. We offer curative services, we have a laboratory.
Of course, from this, word got round and the numbers of those they attended to grew significantly, such that they had to expand the services from general care to other areas including maternal health care. The sisters also had a passion for education, and thus Sisters Consolata and Therese Noel admitted approximately 300 girls in May of 1956 to Our Lady of Mercy Primary School located in Shauri Moyo. This was happening at a time where few Africans were attending school and even fewer African girls getting the privilege of an education. Sisters of Mercy remained part of the school staff up to 1994.
When I came, it was being run by the sisters. Then, when the sisters left, we had now the normal leadership. There were a few buildings here when I came. It has expanded to the point that now we have a secondary who are using the facilities that were initially primary school buildings.
Their work was not only confined to Nairobi, but also to remote areas in other parts of the country, taking with them these two very important services, health and education. In 1958, Sisters Albertus McHugh and Gerard Stark established a women's primary teacher training college. Stark also set up Mboni Clinic and mobiles. Other areas where they set up education facilities included Miguta.
Archbishop J.J. McCarthy of Nairobi requested the Dublin sisters, Mother Dolorosa, if she could give sisters in Miguta to begin a maternity hospital. So on January the 3rd, 1959, Sister Therese Martin and Sister De La Salle came to Miguta. At the time, there was no convent ready for them, so this house that we're in was the parish house. So Father Gannon, who was parish priest, decided that this would become the Convent of Mercy.
Wherever they thought there was a need, there they went to show compassion and mercy by reaching out in areas that mattered most.
And I taught in Ireland for about 10 years, 8 to 10 years, and then the sisters in Killaloo opened a mission in New. It's a remote part of Kitui County, Wingi District. So I was among the first group who went there with Sister Anne Considine, Sister Nuala Galvin, and Sister Breatha Nocton. Now luckily, Sister Anne Considine and Sister Breatha Nocton had spent time working in Motomo. Sister Anne worked for 6 years in the secondary school, and Sister Breatha worked for 4 years in the hospital. So there were two of us new and two with a lot of experience.
Amenisaidia sana, amenisomesea Josephat Bogwa, na saa hii huyo kijana ako university. Saa hii wanasomesa Ani Wajiro, iko shule. Na vile wamenisaidia hata chakula, tulikuwa tunaenda kuchukua chakula huko kwao na tunakula. Wamenisaidia sana mpaka sijui nitaweza sema aje, sasa sijui nitaweza rudia shukrani aje kutoka waje kunisaidia.
Where I started, I was sick with tuberculosis. This is the side where I was sick. The Sisters of Mercy, Pacific Sister Margaret, Sister Anne, and Sister Louise, they're the one who took me as a child to be with them, because I am from a poor family. Sikuwa na money. My parents were able to support me, but Sister Margaret and said here in Lokori Pixie take me as one of beneficiary. Wakanipatia chakula, mafazi, at the same time kunipeleka shule.
Their presence has been felt in many parts of Kenya.
And I met the first group of Sisters of Mercy in December 1968 in Kipkelian. I was at the monastery there. There was a Cistercian monastery which has since closed down, and there were many of the Sisters of Mercy at that having retreat. So that's where I got to know them. And when I came down that year from Kipkelian, for New Year's Day, I went to Makadara, to the convent there, and it was a very pleasant occasion. And I've known the sisters ever since, both in the Mater and in Makadara and many other places. Then, of course, I lived in Kitui for 32 years. And I knew the sisters there in the various places in Nu and Gutani. And then for 3 years, I was administrator of Mutomo Mission Hospital, which was and is still run by the Sisters of Mercy. So I knew the Sisters of Mercy very well.
For instance, in Mukuru slums, where they have primary and secondary schools, as well as a skills center. They established Mutomo Mission Hospital, as well as helped in the education sector. Their presence has also been felt in Eldama Ravine, Mombasa, Nu, Kipkelion, Chepareria, and Lokori. One of the biggest projects of Sisters of Mercy is the Mater Hospital. Started in 1962, the sisters had in mind to build the first interracial hospital. However, this was not received as positively as expected, and the sisters had an uphill task before they could establish Mater Hospital.
You can imagine when the sisters were coming during that particular time, the difficulties that they had, and yet they were certain that they needed to start a hospital that could take care of people of all colors. You can remember that during those days, people used to stay in their own different ethnic enclaves. And therefore, starting a hospital that was going to take care of even the Africans was unheard of, and yet they did it.
Undeterred, though, the sisters pressed on. To date, they have helped numerous people who perhaps would have had a different path, one of despair, had they not answered the call of mercy.
Mater has been a friend to me, to my family. I was first their beneficiary in 2008, and I went a cardiac open heart surgery. And during that process, I was inspired by a certain nurse that nursed me during that period. It was a hard time, and the way we keep associating nurses with injections, pain, and that nurse showed me another way that nurses are not only about that. Her care was, let me say, perfect. And when she took care of me and I got well, I was inspired to go and do nursing.
I suppose the idea behind it was because here we're very adjacent to Macora slums. They are our neighbours. And there was a great need to care for the patients with HIV/AIDS, those affected and those infected with HIV virus.
Henceforth all ages will call me blessed. The Almighty works marvels for me.
Because of the impact of the sisters, more women began to join the congregation, with the first sign-up coming from the Goan community. On 1st May 1961, Sister Irene Pinto, a Goan, became the first Kenyan to go to Dublin, Ireland for formation as a sister.
That particular time, the congregation in Kenya were not allowed to take in any local girls because the church of the time was trying to build the local congregation like the Assumption Sisters of Nairobi, who got a lot of support during those early years. So our first Goan sisters went to Ireland, where they did their initial formation as well as they did their training before coming back to Kenya. 4 of them survived, and today 3 of them are living in Ireland, and one of them is Sister Irene Pinto, who worked in Kenya in Huruma Girls as well as in Kibwezi St. Joseph's and Miguta. She passed on in the early 2000s.
Indigenous women were later integrated into Mercy only after Cardinal Otunga became Archbishop of Nairobi in 1971. On 15th January 1976, the first 3 postulants were admitted for postulancy at Miguta under the direction of their formator, Sister Therese Noel Gallagher. Of these, the first Kenyans who joined, Sister Jennifer Kivu, chose to stay with the Sisters of Mercy.
After my profession, and since then, for 36 years now, I've really enjoyed teaching. It's because education is really the only source that we can help the poor. For our congregation is meant to uplift the poor. So when they are educated, their levels of standard go higher, and the prison of poverty is eliminated.
Miguta remained the formation house until 1982, when it moved to Villa Maria, Nairobi. In December of 1999, when Catherine Macaulay House in Nakuru was finished, the novitiate transferred there. This was done under Sister May McCarron. With the growing numbers of sisters from Kenya in the Dublin congregation, it was felt that an autonomous Mercy congregation should be formed. However, this idea was later abandoned, and instead in July 1994, Kenya was constituted as a vice province. Then, later in the year 2000, it became a province.
Kenya is a province of the congregation in Ireland. There are 7 provinces. There are 4 provinces in Ireland, 3 provinces out of Ireland, Kenya being one of them, South Africa, and the US province. In total, there are about 9 other groups of the Sisters of Mercy, because there are Sisters of Mercy of the Americas, Sisters of Mercy of Newfoundland, Sisters of Mercy of Australia. There are 3 groups of them. The 3 groups of Sisters of Mercy in England. So when you put all the groups of the Sisters of Mercy together, we are in about 44 countries. The mission and the work of the Sisters of Mercy from the very beginning is towards alleviation of poverty through education as well as through healthcare. We also work in areas of spirituality and also in the areas of social ministry.
The first provincial leader in Kenya was Sister Hilary Finnegan. And now, for the first time, a Kenyan takes the mantle as the provincial leader to lead the congregation here to its next chapter.
I am in this position since December 2012. It's an elective position for 6 years.
For Following the footsteps of our predecessors, led by Christ and using the core values to make an impact in this society, the mission to lend a hand and touch a heart continues.
Infect the world with your light. Help fulfill the golden prophecies. Press forward the human genius. Our future is greater than our past.